My name's Mike Ray. I'm the lead of community and co-responder programs with Ambulance Victoria. And one of the programs that I'm very fortunate to work on is the Good Sam program. Good Sam is a smartphone app that originated out of the United Kingdom with a fellow by the name of Professor Mark Wilson, who's a neurologist in the UK. And he saw that people who were seeing patients that were suffering preventable brain injury, often as a result of trauma where they'd been hit in the head or suffered some kind of trauma and had a period of apnea, so a period where they were not breathing and were suffering hypoxic brain injury, or brain injury as a result of lack of oxygen to the brain for that period where they weren't breathing. And he had the idea that if only we could get someone to go and open the patient's airway or to help them breathe in those minutes before emergency services get there, that we could have such a better outcome for these patients. So he developed an app with the assistance of a fellow by the name of Ali, and whilst it was very effective in the traumatic head injury, where it's really taken off is in the cardiac arrest space. So cardiac arrest is an absolutely critical medical emergency where the heart stops beating, they stop breathing, and clinically the person is dead. In those moments before emergency services get there, the actions of bystanders with chest compressions, CPR and the use of a defibrillator absolutely make the difference between life and death. Good Sam allows us to shout through walls to notify people around that someone nearby needs help. Anyone with first aid training who knows how to do CPR can download the app, register as a Good Sam responder, and the app will notify them when somebody nearby needs help. And in cardiac arrest, it's an absolute life changer and a real game changer. Good Sam responders are members of the community who have downloaded the app and registered to be responders, and they are able to be notified in an emergency. Now, these may be healthcare professionals, they might be doctors, they might be nurses, they might be paramedics, but they need not be. They can be anyone who knows how to do CPR. Performing chest compressions and using a defibrillator is something that anyone can do, and in an emergency when someone suffered a cardiac arrest, their heart's not beating, they're not breathing, these simple interventions make an absolute difference and can be the real difference between life and death in a cardiac arrest. Good Sam started in Victoria in 2018 with Ambulance Victoria operational staff. We rolled it out to our paramedics, our off-duty paramedics, and our community first responders who were able to be notified of a cardiac arrest patient or a medical emergency that was happening nearby to them. Since then, it's expanded to include medical professionals, it's expanded to include people with a first aid certificate, it's expanded to include anyone who knows how to do CPR or know how to use a defibrillator. And to date, there's over 13,000 registered Good Sam responders right across the state. And since 2018, Good Sam has contributed to more than 50 lives saved across Victoria, and that's 50 people that have been able to go home to see their families and live on happy, healthy lives. So it's an absolute game changer. People sign up to the Good Sam app for many reasons. Historically, people that knew how to do CPR, whether they be medically trained or not, you might come out of the shopping centre and seen an ambulance parked on the street and someone who is receiving resuscitation, so receiving CPR and defibrillation from paramedics. And often that could leave people with a sense of, if only I'd known, I could have done something. And Good Sam gives you the opportunity to do that something. It gives us the opportunity to let you know that someone in your community, be it a neighbour, be it a friend, be it someone down the street, needs help at the moment where they need it the most. And that early CPR, that early defibrillation, before emergency services can get there, makes such a difference. For every minute that CPR and defibrillation is delayed, the chance of survival decreases by up to 10%. So bystander CPR, bystander chest compressions, and the use of publicly accessible defibrillators can make the difference between life and death for cardiac arrest victims. Since commencing in 2018, Good Sam has contributed to more than 50 lives saved across the state. There are 50 people that otherwise may not have survived, and it's 50 people that have gone home to see their friends, to see their family, and to continue being able to live happy and healthy lives. We have more than 13,000 Good Sam responders across the state that are ready to help within their local communities. And the real benefit of that is not just that they're ready to help, but that they've reviewed their CPR knowledge, they've reviewed their first aid, they have reviewed what they can do to help in an emergency. And that can include preparedness, community resilience pieces like running a call push shock session within their communities, finding defibrillators that may be in shopping centres, they may be in gyms, they may be in sporting clubs, and getting them registered. And to date we have more than 9,000 defibrillators that have been registered with Ambulance Victoria's AED register. And registration of those devices is just absolutely critical so that in an emergency we know where they are and they can be found and used to help save a life. In an emergency or in cardiac arrest, minutes matter. For every minute that CPR and defibrillation is delayed, the chance of survival decreases by up to 10%. So in those critical minutes before emergency services get there, chest compressions and bystander CPR and the use of a defibrillator can make the difference between life and death. So knowing where your nearest defibrillator is can help make sure that you can access it in an emergency quickly and easily. We recommend that defibrillators are stored in an easily accessible location that's not locked up and well signposted so to help people find them. Additionally, they should be registered with Ambulance Victoria's AED register at www.ambulance.vic.gov.au/register. Registration is free, it's easy, and it means that 000 callers can be notified of where your defibrillator is, and Good Sam responders can also find it, making the device easily accessible and easily able to be found in an emergency. Good Sam is always looking for more responders. We aim to have a community of thousands, if not hundreds of thousands, of Good Sam responders right across Victoria, so that wherever you may be in the state, someone is nearby and willing and able to help in an emergency. Anyone can sign up to Good Sam. All you need is hands and to know how to use them for chest compressions, CPR, and how to use a defibrillator. For more information, head to www.heartrestarter.com.au, and there are some short links there on how to do CPR, how to use a defibrillator, and how to sign up to Good Sam so you're ready to help save a life. As we head into the future, we're hoping for thousands, if not hundreds of thousands, of Good Sam responders all across Victoria. We also like to see every defibrillator across this state registered so that people can find them in an emergency and they can be used to help save a life. Technology is growing at such an exciting rate of change that the future is impossible to predict. But things like video triage, being able to remote into someone's lounge room to see what's going on and provide really clear assistance and guidance before emergency services get there, that technology is on the horizon, and in some ways it's almost already here. And we're looking forward to being able to do that. We're looking forward to the miniaturisation of defibrillators so we can get defibrillators into every home across the state and every street across the state, and more innovative ways to get defibrillators to patients in as short a time frame as possible.